Hey future nurses, welcome back. I'm Nicole, a nurse here at Blueprint Nursing, and I'm going to share my favorite part of nursing school with you. Nursing school is a journey. I know people say this all the time, it sounds corny, but it's so true. There's long nights, challenges, close calls on tests, and study sessions that you may laugh more than you study. And amidst all that, it's rewarding. Nursing school helped me grow as a person, and I'm forever thankful for that experience. Before I move on, I apologize for the dark old nursing school pictures, but I had to share pictures of me in my favorite parts of nursing school. So what were my favorite parts? The simulation labs and the clinical rotations. I'm a kinesthetic learner, so being able to physically work my way through some of that learned knowledge was huge. During simulation labs, we get to practice clinical skills that we may not see in our clinical rotations, like code blue resuscitations or what to do if your client has an MI. During clinical rotations, we get to work with clients, learn from experienced nurses and other members of the interdisciplinary team, and get comfortable working in the role of a registered nurse. We get to solidify our classroom knowledge in the clinical setting. Simulation labs were something that we looked forward to in my program. While it wasn't an advanced simulation lab at the time, it was still a beneficial experience. We had a safe place to practice crucial life-saving skills before facing these situations in real life. I loved having a place where I could feel more comfortable in trying out new skills or practicing calling providers for the mannequin that was 10 centimeters dilated and ready to push. While it had the tendency to be a little nerve-wracking, it still was one of my favorite experiences. Clinical rotations allow for us to gain experience in different areas of nursing, which I think is crucial. Being able to practice in a variety of settings was a great way for me to learn what areas of nursing I wanted to work in after passing the NCLEX. I also bonded with my peers, the nurses I followed, and my clinical instructors. I learned so much from so many nurses, and it helped me piece together the skill set I have today. Some nurses even got jobs on the units that they had clinical rotations on. Clinical rotations allowed me a space to try skills, actively learn from the people around me, and gave me a taste of what it would be like as a real deal registered nurse. Something I didn't mention, that these 2 bits of nursing school were a cool way to see my growth as a nursing student over time. I did an ADM program, so it was 4 semesters, and to see the first semester nursing student who was afraid to perform a physical assessment grow into the 4th semester nursing student that was collaborating with other nurses and providers for a client who needed a cardioversion, it was, for lack of better words, the coolest thing. It is nearly impossible for me to talk about every bit and piece of nursing school. It was such a huge part of my life, so thank you for letting me share my favorite part of nursing school with you. If there are any topics or experiences that you want to hear more about, let us know. Otherwise, see you next time.